Hello and welcome to another episode of the Project Purple podcast. I'm Dino Varelli, founder and CEO of Project Purple. We have an exciting interview coming up with a special guest after a few quick updates. Since 2010, we've contributed over $3 million and counting to pancreatic cancer research efforts. We also allocated over $1 million worth of aid to more than 1,300 patients and families throughout our patient aid programs. Your monthly or one-time gift can improve patients' lives through research and assistance programs. You can donate now at projectpurple.org. Pancreatic cancer does not rest, and neither will we. Your support is truly appreciated. If you're looking to get involved in one of our events, whether that means joining a run team, participating in a virtual run walk, group fitness, golf, or anything else you can think of, visit projectpurple.org/events to learn more. Without further ado, let's meet our special guest today, coming to us all the way from Missouri, the wonderful state of Missouri, Dawn Szabolcsi, pancreatic cancer survivor. Welcome to the Project Purple podcast, Dawn.
Well, thank you for having me.
So we were playing kind of catch up before we hit record. Missouri is a state that it's one of those flyover states for me because I'm usually stopping in Nebraska or Iowa in the Midwest. And I love the Midwest. I know you're not originally from Missouri, but it's a great area. I have some really good friends in Missouri, in Kansas City, and in the St. Louis area. And I'm born and raised in New England, but I think there's something special. I know you've traveled quite a bit through your life here in the United States. I think there's something really special about the Midwest, and there's that, the Midwest nice, but I tend to think that's how humanity and how humans should be, even though people in New England and New York are not nice, very nice often. Not saying that there aren't nice people, I'm not saying that, but I think there's a way of life, of faith and family, and just being genuinely nice to say, good morning, how are you? And have genuine conversations with people. I tend to have more of those conversations in the Midwest, from Chicago all the way down to the South, than anywhere else in the country that I've traveled. And it's kind of just an interesting experiment, not an interesting experiment, but an interesting thing for me. And so I just love that part of the country. It's a great part of the country. The only thing, being a New Englander, you're kind of landlocked. I know there's rivers and lakes and stuff, but we've got the ocean not too far from us. And I don't know. I brought it up a couple times to my wife to move out to the Midwest, and she's like, the water's too far. So you pick your battles, as I say. Well, excited to have you on. As I mentioned, the first segment of our podcast is always a guest opportunity to share kind of their background, their journey with pancreatic cancer here. Hopefully your friends and family, as I said, will be listening in and they'll know this to some degree. But a lot of our audience don't know Dawn, and we'd love to share that information with them. So with that, I'm going to hand the microphone off to you. And as I said, I'll be taking notes and jumping in from time to time, but the microphone is yours, Dawn.
Hey, thank you so much. Okay, my pancreatic journey, it started, good Lord, it started like years and years when I was, I guess, younger. I always had issues with back pain. Constipation was a big thing for me. I remember one time when I was 10 years old and I just had problems using the bathroom. So my mom would take me to the doctors all the time. They would suggest like Phenamint. I don't know if you remember the Phenamint gum, but that was like years ago. It was disgusting, but it helped you use the bathroom. So, so that was the thing that they used to do for me. But then as I got older, I kept having those issues where I would have like constipation so bad, I would use the bathroom like maybe once or twice a month. And that's not normal, obviously. You know what I mean? So as time progressed, it got to the point where I was in pain. I remember it was back in 2010 when I was in the bathroom. It was blood. When I had excruciating abdominal pain. I didn't know what was wrong with me. And that lasted for about maybe 2 hours. And I was afraid to go to the doctor because it was embarrassing to go tell, a doctor that you're having issues using the bathroom. Those are the type of things that I just wasn't raised to talk about. So the problem kept going on and on, and I finally had to end up going to the emergency room. And that's when they had thought maybe I had IBS. So then they sent me to a gastroenterologist. So they ran their test and did everything, and the doctor couldn't find anything. He said that I had symptoms of like Crohn's and IBS, but I didn't test positive for it, you know what I mean? So then they kept sending me to different doctors. Out of like five or six doctors, only one told me, he said, Dawn, we don't know what you have, but you have these symptoms. So well, and then he sent me somewhere else. And then, that doctor just said I had an IBS. So we went with IBS. And so, all these years it was like IBS. It was the abdominal pain, the cramping. It just kept progressing and progressing and progressing. And then it came to a halt right at the start of the start of COVID. We had got COVID. My husband and I, we had just bought a house here in Missouri. We bought our home, ended up having COVID like 2 months after we moved in. And then, we were sick, like I was sick really bad because I had asthma and everything. I had to go to the hospital because I couldn't breathe. And it was just a big thing. And so then when I got better, I was still having those issues. But then, like May of 2022, we were in Illinois to visit my in-laws, and I was having the bleeding, the pain, and it was so bad we ended up coming all the way back home to Missouri because we lived 3 hours from my in-laws. And we stopped at the hospital, the emergency room, and they did a scan and they found diverticulitis. Well, a month later, I'm back in the hospital again because of the same issues. And so then they referred me to a gastroenterologist in Springfield, Missouri, where I live. And so, that doctor found a mass on my pancreas, a tumor. So he said, well, it's not, cancer. He didn't think it was, cancerous or anything, but he wanted to send me to a surgeon in St. Louis. So he sent my letters, actually, because I have notes here too, because I wanted to get this right. But he sent my workers to a Dr. Ryan Fields in St. Louis, and they were
Mhm.
supposed to call me to set up a time for me to come down there to see them. Well, my workers ended up getting somehow transferred to a Dr. William C. Chapman. He's actually over the liver department in Washington University, and I really
Mhm.
believe that that was a God-given thing because Dr. Chapman he's an amazing surgeon. I just love Dr. Chapman. He ran his scans. I know Dr. Chapman is one of those meticulous people. He likes to have his T's, crossed and his I's dotted. He does not like surprises. Okay. So he ran all these tests, even tests, and looked over. And then it was like the day before my surgery, because they had decided that they were going to do, I think he called it a distal resection and splenectomy. That's what they were
Yep.
going to do, right? Because to remove the tumor from my pancreas. But then he just wanted to do a PET scan the day before, which I don't know why. He never told me why, but he did. And then they ended up finding a lesion on that scan. So then they ran an MRI the same day that they did an MRI, and then an MRI found another lesion on my liver, but not the same one that the PET scans found. So then we did the surgery November the 11th on 2022. And when he opened me up, Dr. Chapman said that God, when he opened me up, it wasn't what they thought, what the scan showed. He said the tumor was actually laying on top of the pancreas. So they were able to scoop that out. But he said, but they didn't take my spleen, thank God. But they did found, I think he said it was like 12 lesions on my liver. The other 10 didn't show up on any of the scans. The other two that they were able to find, they were able to take them up, cut them out, you know what I mean? And that's where I guess the resection came in or whatever. And so then when I woke up, and he said, Don, we have bad news. He said, you actually have, pancreatic neuroendocrine tumor. And I didn't know what that was, you know what I mean? Because first of all, I had this surgery that they cut me from like above my breast all the way past my navel. I'm in excruciating pain. And you're trying to tell me that I didn't just have a tumor that was benign, that now I'm stage 4 cancer and I'm dying. And that was a shock because 'cause I went from one thing. I said I went to bed, or not bed, but I was put to sleep, okay, told one thing, and I woke up and I have cancer and it's metastasized to my liver. So that was a big shock to me and my husband. But I ended up spending like 4 days in the hospital, and then they ended up sending me home. Dr. Chapman asked me if I could find an oncologist, and I said, to be honest, in Springfield, it's really hard to find doctors because you have a lot of people here, but not enough, specialists. So Dr. Chapman knew a few oncologists out here in this area, and he got us, in connection with Dr. Jessica Snyder from the Chubb O'Reilly Clinic in Springfield, Missouri. She's an amazing woman too. I love her. And so with her, he was trying to explain to me, what it was, but it was just hard for me to grasp at that. You know what I mean? Even now, because I was 54 years old when I had that surgery. I turned 55 like 6 weeks after that surgery. And then I seen Dr. Snyder like 4 weeks after that surgery, still in December, right before my 55th birthday. And so then when I went, and so then with her, she wanted to start a treatment called Larinatide. I don't know if you heard of that, on the injection. It's an injection, and it works with your gene molecule, because they said the type of cancer that I have is genetic. Which she tried to explain that I guess 2% of pancreatic cancer had the type of cancer that I have, and
Yeah.
it's a rare type of cancer, she was saying. And so, which I didn't understand any of this. And the thing I think what got me upset about, like you said, the medical, is that I had to do my own information. My own looking, because they tell you stuff as if you should know, or if you know the terminology. Now, I do have a sister-in-law who's an RN, she's a physician assistant now, and she was trying to explain to me and my husband. But if we didn't have her, you know what I mean, we would have really been lost. And so then I started to do my own research to see what the heck do I have? You know what I mean? What is endocrine tumor? And when I started reading it, I was not happy about it, obviously, but it was just a lot of information. You know what I mean? A lot of information. Because I tell my husband, like, at the time, we had got sick again with the COVID, so that's why I thought I was getting sick again with COVID, and that's when all this stuff came out with the tumors and all this other stuff. So it was just a lot for my mind to comprehend. You know what I mean? Even now, it's still sort of hard for me to comprehend this.
So I'm going to jump in here, and I got some questions here. So you were diagnosed with a neuroendocrine tumor with a
Right.
genetic marking, and
Yes.
so part of the pancreatic cancer family. There's debate, and this is kind of a silly debate in our minds, because whether it's adenocarcinoma, which is a little bit more, it's more common than the neuroendocrine,
Right.
but the neuroendocrine is as bad as the adenocarcinoma. And I think people tend to think, because they use the example of Steve Jobs, like Steve Jobs had a neuroendocrine tumor,
Right.
and he lived for such a long time, but the neuro endocrine tumors are ruthless, especially when there's a genetic piece associated with that.
Right.
So this is as serious. I just want to put this out there, for people listening, and also, for our own edification here, that it's no less serious than an adenocarcinoma, I guess is what I'm trying to say here, Dawn.
Right.
So you go in. I want to go back to like the very beginning now first. In constipation, I'm just going to sum it up as GI issues, right? And I think, like, as a society, right, like there's a couple taboos, and GI is one of them, right?
Yes, it
No,
is.
you don't go to cocktail parties, or you don't go out with friends, or you don't show up at like the kids' baseball or sporting events talking about your GI issues. It's just like
Right.
people don't do that, right? But this
Right.
is, I'm glad we could kind of giggle about this a little bit. But the fascinating thing is, we've talked a lot about this on this podcast. And I think one of the ways to get through the taboo is having discussions, and having serious discussions, and not like
Right.
joking. I don't mean like, joking
Right.
discussions and making fun of it. But, like, if you think about, like, your body, you ingest food, your body's a filter, right? It goes through your organs and everything. And then what you excrement through your GI tract
Right.
can tell a lot about what's going on in the body, right? And
Right.
so we've had patients come on and talk about, like, I remember, one guest in particular had like this massive GI issue for like 2 weeks straight, like couldn't leave his house, could not go to work, couldn't
Mm,
function for 2 weeks, and then it was gone. And that's just odd, right?
mm,
um we've had other people that talked about, similar to your situation here, where it kind of ebbs and flows and comes and goes, but it's not like you can leave the house. And I think
right.
what happens, and this is you're young at the time. You said you were 10 years old, so no one's thinking cancer, right?
Right,
The alternatives are like IBS or Crohn's and colitis, which is exploding for whatever reason, whether that's like our food system or genetics, don't know. It's just kind of interesting. Colon cancer is on a rise too, as well, right? Like we're
right,
seeing
yeah,
people in their 30s and 20s getting stage 4 colon cancer, which we've never seen ever in the history of
right,
medicine. So, the whole GI thing, I think, is a little bit of an evolution. But for us here in the PC space, I always, and I love that. And thank you for being open and honest, that people need to be aware of their GI issues and their GI tract. Not joking, but I've had two guests that, again, had similar paths in terms of having GI issues. And they both came up with the idea, like one guy who lives here in Massachusetts. I know we talked about it at length of like his idea of having a toilet that can actually diagnose via
right,
your stool, which is
right,
fascinating. And yeah, we're laughing, but that's like that could be a game changer, right? Because again, if you think about the filtering and what comes out through the GI tract can tell a lot of how the body's doing. And then there
right,
was another young lady in London who's put together a book that talked about poo and the
right,
importance of poo, and she's a pancreatic cancer survivor. So, that is something that I think it's frustrating listening that at 10 years old, like you had these issues, and then even as you got older, through from 10 to 55, that's a long time.
yes,
You had these issues and no one ever like from whether it was and I'm not trying to point blame, and also Dawn, we know hindsight's always 2020, right? Like we can
right,
always look
yeah,
back and say, oh, well, this, that. But also it's frustrating as an advocate to know that someone was going through the healthcare system for so long and no one was like, GI issues? Oh, you have a history of GI issues? Oh, let's just do a CT scan, like let's do
right,
an MRI like of the GI tract or the pancreas and see like where everything's functioning versus just like topping it up to IBS. Now, in all fairness, I'm not a doctor. I don't have a medical background. Um, so also we do know sometimes with all tumors, sometimes they're not present, right? Like, and
right,
to your point, they go in, and this is the other frustrating thing with the systems and the systems available, like especially for screening. Like I I know with MRI and CT, usually with lesions, like if the agent that they stick it, they give you IV, right? They give you an agent when you
right,
go in for that MRI or CT for the pancreas protocol. If that agent doesn't adhere to any of the lesions, then the screen pops up and they don't see anything, right? And
right,
so
yes, true,
when they go in, I'm sure they may have mentioned that to you post surgery, why there was like, why did they see two on the MRI and then they open you up and they have like 12, right? But
right,
so that's the other tricky piece, right? Is I don't think our technology from a diagnostic standpoint, which we talk about often, sometimes is 100% accurate in the sense that it doesn't see these like micro lesions that maybe, when they do the surgery, they open you up, they can actually see them with the physical eye, right? Because they
right,
can see the organs and they can see the lesions there where, sometimes the imaging, as great as it is, just isn't 100% accurate. And that's super frustrating, right? Because as you said, you
yes,
went
it
to
is,
sleep saying, hey, okay, we know what we see on the screen. The tumor's there. They're going to do this, distal, and they're going to take everything out, my spleen and everything. And then they open you up and you're like, oh my God. Like you wake up and it's like a totally 180 degrees.
right. And I think for my oncologist, she was saying that my blood work, they were just mildly elevated. And she said, because I don't have the jaundice of the eyes, I don't have the yellowing of the skin. The thing that I had that was jaundice is my stool. But you don't think about that. And so,
No.
with her, she said it was just, and plus she said that I don't look sick. You know what I mean? I mean, because I said I didn't think I was sick. I said, 'cause I remember back in 2011, I saw a specialist in St. Louis, and I'm not gonna say her last name, but her name was Elisa. And she and we went to go see her, and she told me that I was fat, and that it was in my head, that I was crazy, that I need to see a psychiatrist, that there was nothing wrong with me. And I was so devastated. Yes, I was fat. I lost a lot of weight since then. But for her to say that, and then my husband had wrote a letter to the hospital board. They apologized, but she never did. And I tell my husband, years later, I went back to go look at reviews on her, and almost
Yeah.
everybody said the same thing. The only people that, which were very few, that gave her good reviews were the ones that she found something with. And my whole thing is, don't blow people off because you can't see it. We know our
Right.
bodies, because I'm not a hypochondriac. I hate going to doctors. I usually wait till the last minute to go to doctors. But to be told that, I sort of just, like, how you just, then I started to think, well, maybe this is all in my head. You know what I mean?
Yeah.
Maybe I am, you know what I mean? So, and then I started to doubt myself. But then when I got this diagnosis, it's just changed everything for me. You know what I mean? Because my whole life's changed. Since then, I just had a genetic testing done 2 weeks ago because we're trying to see what is, like you said, the genetic code, to see if my daughters and their children have this genetic code so that they can be looking out for it. Because my daughters are they're scared, which I can understand because I'm, 'cause I'm going through this. The pain is horrible. And we just found out like 2 weeks ago, which is why I had to reschedule with you in the first place, was that the cancer has moved to my spine. So I've been having more issues, more abdominal pain, more, bone pain. Because I tell my husband, I said, something's going on. My bones hurt so bad. And so then I started seeing a palliative care doctor, and they put me on a paint, like the patch. I don't know if you heard it, but it's called the
Fentanyl.
Burfenefin patch, right?
Yep.
They did it up to, they started me low. I'm on 15 micromilligrams, and I'm taking 10 of the oxycodone, and sometimes that
Yep.
does not touch the bone. But so now they want to do a thing called radiotherapy with Lutathera. I don't know if you heard of that before.
No.
Lutathera, it's a radiation isotope where they have to do it with IV and and it takes 6 hours to do. There is side effects more than what the Lenartide is. Because the Lenartide, I ended up having to have my gallbladder removed, because of side effects or whatever. And
Yeah.
so now I'm sort of, I'm not going to say fearful, because I have faith in God, that God is a healer. And actually, Dina, that's what's keeping me, is my faith in God. I tell my husband, is it wasn't that, because I know my doctor said that they cannot cure me. She's just trying to prolong my life to give me more time. So she said, Dawn, you're going to need a miracle if you're going to beat this. And me, I said, I have an amazing church family out here in Diggins, Missouri. We go to Greater Life Church, and they have given me so much light. Because we're here in Missouri without family, because my husband is here and it's just me and him. Our family lives in Arizona and California and Indianapolis. So it's like we don't have that support system. And there's times when I wish that I had somebody that I could talk to about that is going through it. I actually went on the Mayo Clinic, because they have like support groups, just to
Yeah.
talk to somebody who's going through this. But it's hard because you try to have this positive attitude, and I have faith in God, and people only see the good days of me. You know what I mean? They see the happy-go-lucky Dawn. They don't see the Dawn that's scared, or especially now with the radiation. I'm scared,
So
because I don't know what's back.
I want to ask a question here. So and this goes back to, and we're going to hit on all these points here in a second. So you go through the surgery, you get the oncology. Does it kick down? And the surgery was back in like 2000, late
22.
2022. Yep.
Yes, sir. No, yeah, November 22.
And so you've been on, I would say, chemotherapy or some sort of treatment since the surgery, since recovery and everything.
Yes, I've been on a Larentyne injection since right
Okay.
then. But they said obviously it's not working because the lesions are getting bigger and it's spreading.
And in terms of tumors, have they seen any other tumors anywhere? Because I know sometimes these neuroendocrine tumors kind of pop up in other places, whether it's the liver, like the spleen, or other organs in the body.
No, they said the only thing they found was a tumor in the pancreas, and then the lesions inside my liver, and now on my
On the
spine.
spine.
Hmm.
Wow. Because you brought up genetics, family history, Dawn, because sometimes these types of cancers do kind of jump along the family.
Right.
Mom and dad, siblings, any cancer in the family at all?
Actually, I don't know my father or his side. I never met him, so I don't know. That's why we did the genetic testing. My mother said that nobody that she knows from our side of the family has it. So I'm like, how likely is it for me to be the first?
Yeah. Do you have siblings?
Yes, I do. I have five,
And none of
and
them
I'm the
have
only one.
any?
No,
Wow.
I'm the only
Wow.
one.
That's an interesting. I mean, usually like when we and I just speak from experience and from what I know a lot of times, um, we see families with multiple pancreatic cancers in the family, and I know neuroendocrine can act that way as well, where you see generations, potentially like a grandparent may skip a parent, but that parent maybe a gene carrying, right? And they don't know, right? Like, and genetics
Right
is
now.
such a fascinating thing. I mean, I think that's just, there's so many positive things happening. And we've had many researchers on the podcast talking about all the great things that are happening. But I think if there's one space in particular for cancer as a whole, genetics, and in
Right.
particular pancreatic cancer, like we do know that a large part of them, should say a large percentage of them, are known to be because of some sort of genetic mutation that is passed on from generation to generation. We know that now. We didn't know that 10 years ago.
Right.
The last 5 years has been this like almost like epiphany in genetics. And, I think we're going to continue to see like a fast moving pace with genetics because there's a lot of groups on the for-profit side and on the academia side where a lot of the research comes out of, like focusing on genetics as a whole.
Right.
And potentially, there's a huge vaccine trial going on with some of the genetic stuff that's across the country, not just in one center now. So it's really an exciting time, I feel, for genetics and cancer.
Right.
But knowing is really key, right? So,
Yes.
that knowledge and that power that you have, like having the knowledge and then having the power to like do something about it, like depending on treatments and what I say, doing something about it, like your oncologist and the team and the researchers. There's just a lot happening in that space. So that's a positive thing, what you find out and if you find out, because I think that could be a game changer potentially. We've seen it on our side.
Right.
You talk about faith a little bit, and I want to spend some time here on this. Was that something as a family, like just always been part of your family and part of the kind of like you said you have two daughters, I think, right?
No, I have four daughters.
4 daughters. Okay. Okay.
Yes, four
So
girls. Hmm.
was that something, God bless your husband. He had 5 women in the house at once, I'm sure. I have all boys, so I know how my wife feels. And, now we have a one male dog. So
We had boy dog too.
oh, you did? Okay. All right. All right. There you go. There you go. We had a female dog. We had to put her down recently, but
Right.
now my wife's like Jones and she's got like, and now my boys are off to college. So she's just stuck with
Right.
me. So she's in trouble. So was faith always a big part of the family, as raising the 4 daughters and what you've kind of always kind of known?
Actually, faith has for the past 15 years, but when you get a diagnosis like this, it really tries your faith. And so, and this has really tried my faith. But like right before that surgery, I was at church, and some of my church family came and prayed for me, and I just had a peace about it. So I've been having a peace about this whole thing. That's why, yeah, I do get fearful at times, especially with radiation treatment. But for the most part, I'm very optimistic that God's going to heal me. But if it wasn't for faith and for God, believing that God's going to heal me, I don't know where I would be. You know what I mean? That plays a big role, especially with my family. You know what I mean? We
Yeah.
believe in God. We believe in miracles.
So powerful. I will tell you, I know we talked before we hit record, and we've had hundreds of survivors on the podcast, and there's some common themes that we see in all the stories. And two you just mentioned, faith, which is usually one or two, and regardless of what religion, it doesn't matter. Just that you have faith in some sort of religion, whether it's Christianity, Judaism, Islam, Buddhism. We even have people come on that are Buddhists, and they just have this really really strong rooted faith. But I will tell you this, Dawn, it's just so powerful to see how those people are thriving, in terms of, fighting pancreatic cancer and how they react to that is just really, really special. So I appreciate it. I know faith can sometimes be kind of alienating, I guess, nowadays. I don't know. I was born
Yeah,
Roman Catholic.
right,
I don't practice. I don't go to church every week. I haven't gone to church in a while. But it was such an integral part of my upbringing.
right.
And I think like if it doesn't make you any different if you don't go to church. I'm sure the priests probably don't want to hear that, but I've
Right.
gone to I've gone and celebrated Greek Orthodox. I've gone to temple, with rabbis over the last couple of years and celebrated people's lives and services.
Mhm.
And so I just think just faith is just so important and it's so powerful to have that with you on these journeys, but as a whole, right? Like if you think about like spirituality and who we are, not that I'm trying to force religion on anyone by any means. That's not what I'm trying to say here. But I just think
Right.
it's something very unique that I have seen as a witness to being
Right.
involved in pancreatic cancer and the strength that people find in faith and how that, like you said, miracle.
Yes.
The stories of like Jesus turning water into wine. I
Come
mean,
on.
I've seen that. Not I've never seen anyone turn water to wine, but I've seen like amazing things
Miracle.
happen to people because of their
Right.
faith. Is what I'm trying to say. So it's
Exactly.
it's just so powerful. So thank you for sharing that because I know
You're
sometimes people
welcome.
get kind of funny with talking about
Right.
faith sometimes. Talk about the family and talk about your husband a bit. We just mentioned your four daughters, your grandkids. I know it's probably been really hard them not being local, but with some of the support and things that you've kind of received from your family and what that's meant to you during this time.
It's I don't know, but it really means a lot. Like my daughter, like one of my daughters from California, she just recently came here to see me with my grandson. I have another daughter coming in 2 weeks, and then one who just came from California. She's coming again, and then so I just have family coming. My in-laws just left here, so people are just coming to keep me together. But I said I fall asleep a lot because I'm so exhausted all the time, or like or like if I'm in a lot of pain, I take my pain meds. So I
Mm.
try to do a lot of stuff, but recently the walking sometimes hurts because of my spine. So I'm sort of limited time. There's times when I try to do stuff and I have to go sit down because I hurt so bad. But I love my family coming here, and they're not here, but I do my YouTube channel and I do like a vlog, just talking about my everyday life so that my children will see this, to see what I'm going through, to see how my day is, just so that they will have something of me when I'm gone.
Special.
So yeah.
Another question here for you, Dawn, and staying in this kind of family and friends kind of theme. Oftentimes, we get asked here at Project Purple, "Hey, my neighbor or my sister-in-law or someone in my family, I should say, just got diagnosed." And the question is like, and you don't have to name a person. You can be very general with this. You don't have to put anyone on the spot. But is there anything that someone did for you, family or friends, that kind of really meant a lot for you during this time? And where this comes from is again, like people reach out to us and say, like, "Hey, we know someone who just got diagnosed. What should we do for them?" And I often think like the general public doesn't know. Like they don't know
Right.
how to support people like battling cancer, in particular here, pancreatic cancer. So I always kind of ask the guests like what's give us an example, like what was something that someone did that was just so powerful and so meaningful for you during this time.
I think for me is to treat me like I'm still Dawn, because I mean, like a lot of times they feel like you have cancer, you can't do anything, you can't help. Like I do a lot with the church, like making church dinners, I make desserts and I do this, and they're like, Dawn, you don't have to, because I said no, I want to. If I cannot do it, I won't do it. But I want to still. I don't want to lose myself in this cancer. You know what I mean? This pancreatic cancer does not define me, and I don't want it to define me. I want to still, like, I still work now. I still do stuff. Of course, I put in my notice for, a couple of weeks because my radiation treatment starts,
Hmm.
and my boss and they'll fulfill, because radiation, and they're sort of nervous about it. But
Yeah.
I just want to keep my life as normal as possible. You know what I mean? And treat me like Dawn. Don't treat me special. Don't treat me with kids' glove. I want to just be, Dawn.
I love it. It's powerful. I've got two questions left for you here, and then we're going to share with our audience where they can connect, follow you. It might be the
Okay.
YouTube vlog or somewhere else. And these last two, there's no right or wrong, Dawn. I use this term loaded because they're loaded, they're thought provoking in that sense. But again, they're your answers to it. So, there's not a right or wrong to it. First one is someone listening or watching, if they're diagnosed, what would be your advice to them if they were diagnosed today and they were watching this? Like, what are some of the steps that, they should think about or take in terms of the best advice that you could give them?
I would tell them to find as much information as they can, like knowledge, because like even now, I didn't know anything about like disability or anything about, any of that. My doctors really didn't, I guess, mention that. What they really need to do, I think, is when they give you a diagnose, let you know that there are services out there that you can tap into. I didn't know that until I started asking questions. So, when I started asking questions, when I started doing my research, then they were giving me answers or whatever. But I'm all for finding the stuff for yourself. You know what I mean? Fight for yourself. You know what I mean? Because that's all you can do. Nobody else is going to do it for you but you.
Was your personality that way before you got sick?
My personality was, it's still outgoing and everything, yeah. But I think when I got sick, I sort of shut myself off at first. But I'm like,
Yeah.
no, I'm gonna be Dawn. I'm gonna be crazy. I decided to do the Victorian route. I always loved Victorian, but I thought about what people would think of me. Dude, I don't even care no more. I said, you know what? I'm living my best Victorian life. I got me Victorian clothes and boots. I got rid of all my modern clothes. My husband hates it, but I love it. So I like, just be your true self, live your life. I'm living my life to the fullest, regardless.
Oh man, that was just so powerful. And I, the advocating for yourself, and I think that you just hit something like so powerful because we often say like it's this don't ask, don't get, right? Like the hospitals and the systems. I just had an email interaction with another patient, and he's like, he listed out like 15 things that like, because I asked him, we're trying to connect and trying to support him, and he listed 15 things that he wish he had before because like no one told him. And I know before we were hitting record, we talked about the systems, right?
Right.
The system that people have to understand. We live in a great country. This is not a bash on America whatsoever. But when you
Right.
compare our healthcare system to, let's say, Canada or Europe, where you have these public healthcare systems, there's pros and cons, right? Like in
Yes.
Europe, people get the same treatment no matter where they go, no matter where they live. So whether you live in, and I'll use Italy as an example. Well, we can use, Canada as an example because that's probably more, people geographically. Whether you live in Toronto or Vancouver and you get sick with pancreatic cancer and you go to the public healthcare system, you're going to get the same type of treatment, the same type of protocol. Now, you may not see a surgeon or get an MRI. Could be weeks, it could be months, right? Because of the strain on the system. And that's not to say that people that aren't seen in those countries. You just have to buy private insurance. So public insurance only gets you so far. But it's consistent, right? It's consistent across the board. Here in the United States, it's kind of the opposite. Like regardless of your insurance, you're still going to get seen, might not get the best of care, but also where you go matters, right? Like you
Yes,
said,
it
like you
does.
had to go down to Wash U, which is a great center for pancreatic cancer care,
Yes.
versus staying in Springfield, and we were talking about before we hit record, you're originally from El Paso. We had a guest from El Paso. El Paso is a huge city. It's 250,000 people. They don't have a major cancer center that specializes in pancreatic cancer. So I had to go 9 hours to MD Anderson. So here in the States, it's like access, and then like where you go determines like the type of care you get. And then possibly even within that system, you're not going to get everything that they could provide because you
Right.
didn't ask. But that's just the way the
Exactly.
system's built, right? Like it's not
Right.
like doctors aren't maliciously doing this, or nurses.
No,
They do provide information. And I think the other thing too, as a cancer patient, like there's this overwhelmingness, right?
it
That
is.
people get kind of overwhelmed, and it's like they shove all this information in front of you, but they don't
Yes.
give you like, all right, what's important here? Like, what should I be digesting? Should we be concerned about chemo side effects first or the surgery? Right. And I
Right.
think that's also part of the system. And, I think part of it is also insurance, because doctors have to see, 30 patients a day in order to pay for their student loans, pay for their lifestyle, whatever that is. Everyone's different. Not my problem.
Right.
My problem is the system's broken. And
Exactly.
we try to like educate, and to your point, that knowledge, right? Like sharing strategies on how to advocate, sharing strategies on what to ask for is just super powerful. So thank you for bringing that up.
Right.
My last question here, and this is always, the loaded question is, given your experience, there's no right or wrong answer to this. How would you define the term pancreatic cancer? What is Dawn's definition of it?
Pain. It's a lot of pain. I could deal with the tiredness, you know what I mean? I can deal with the nausea. I can deal with the vomiting, like the pain. I've never experienced this. I mean, 4 daughters. I know pain. I had surgeries before, but this blows. I can't even explain the pain of this. I mean, times I'm in pain where I cry myself to sleep, or my husband's praying for me while I'm crying because the pain is not touching the pain. You know what I mean? So for me, it's pain.
Well, Dawn, I hope your oncology team can help figure that out, because no one should be in pain. I mean, I know that's kind of easy for me to say,
Right.
but this disease is just, as I say, is evil. But people shouldn't be suffering for it. So thank you for
Yeah.
that answer, though, and for being honest.
Thank you.
Dawn, I want to share where our audience, someone listening, I know you mentioned the vlog. I think you're on social. Where's the best place for people to connect or to learn more, to reach out to you? Like I said, if maybe there's someone in the Springfield area that's going through the same thing. I always say there's strength in numbers in battling this, and no one should fight alone. So what's the best place for people to do that?
Okay, the best place to do me would be on Instagram, and that'd be Lady Dawn SZ. And then when you go to my Instagram, it'll take you to my YouTube channel. So I have a YouTube channel also.
Awesome.
Mhm.
Dawn, thank you for being a guest on the Project Purple podcast and for sharing your journey with pancreatic cancer. You truly are an inspiration to us and to our community as a whole. Thank you.
Okay, thank you for having me.
Thank you for listening to another episode of the Project Purple podcast. If you liked today's episode, feel free to share this episode and make sure to follow us wherever you listen to podcasts. That's a wrap of another episode of the Project Purple podcast. Till next time, please be safe. Thanks for listening.